Hello again. It's Paul with New Jersey Recovery and Wellness. Thank you for continuing to join us as we commemorate National Recovery Month by talking about how you can support a person who you know and love with a substance use disorder. Thank you for tuning in to day 9 of our 30-part series. Come check it out. Nine, attend a Narcan training. We are in the middle of an epidemic in opioid overdose deaths, one that's been a long time in the making. Over the last 2 decades, we've seen year-over-year increases in the rates in opioid overdoses. In response to these tragedies, a combination of changes to public policy, community outreach, and grassroots efforts to advocate for prevention have been made, and yet this trend has still been seen to increase. With the introduction of Narcan, an overdose reversing agent, and the monumental push for public, free, community-based education and training, gratefully in 2018, we saw our first decrease in the rates of overdose deaths in over 20 years. Hear this, Narcan saves lives. You can support a person you know with a substance use disorder by attending a Narcan training. Now, let's get into a few questions on this topic. First off, what are opioids? Opioids are a family of psychoactive substances that serve as a CNS depressant, meaning that they slow down the central nervous system. Drugs that fall into this category include heroin, fentanyl, carfentanil, and opium. Other prescription medications can be opioids as well. These include OxyContin, oxycodone, Percocet, Darvocet, Vicodin, hydrocodone, hydromorphone, morphine, amongst many others. Point here being is that many people who have started using prescription opioids were taking medications that were prescribed to them by a physician, typically following a surgery, a dental procedure, or as part of routine pain management. How does a person become addicted to opioids? People can develop an opioid use disorder from prolonged exposure to the drug, such as taking medication over a long period of time. The drug has chemical hooks that make it psychoactive and desirable once it activates the reward pathway in our brain. Over time, our body and our brain become used to the drug, and because it feels good, we require more of it in order to maintain the same or a similar type of sensation. This is referred to as tolerance. More often than not, an individual who ends up developing an opioid use disorder has started off with a prescription pain medication. In some cases, they were prescribed personally, and over the course of time of their prescription, they may have begun to misuse their medication, taking more than initially prescribed for a dose, or taking it more often than the prescription says. Others, however, they may begin experimenting with medications that are not their own, trading substances with friends based on what can be found in a medicine cabinet, for example, or purchasing these particular medications the same way any person would purchase any other type of illicit drug. The problem with opioids is that because they naturally have a greater potential for addiction, tolerance develops rapidly, and other opioids, stronger ones, may be more readily accessible and far less expensive. This is often how people transition from using pain medications to using other drugs, such as heroin and fentanyl. What's an overdose? A person experiences an overdose when they take too much of a substance than their body can handle. To understand this better, let's break down the process of opioid use. A person uses the substance, which may be consumed orally, snorting it nasally, injecting it, or smoking it. The drug eventually is going to reach the brain. Of course, certain routes of administration are going to lend to the substance hitting the brain much faster than other routes. But whatever way a person takes in the substance, eventually it's going to hit the brain. Once it does this, it binds to a particular receptor site, and this is referred to as the mu-opioid receptor site. Once binding has occurred, the brain releases a set of chemicals referred to as neurotransmitters that flood the brain with calming sensations, signaling the body's systems to shut down. This is why opioids are classified as a CNS depressant. When body systems are slowed down, we commonly see a person have a couple of symptoms that are pretty telltale that a person's using opioids. Some of these most notable symptoms are a person getting sleepy or nodding off when you're trying to have a conversation with them. They can have a lowered sensation to pain. They might not notice when a person is touching them. They can have delayed responses in general. And the two big considerations to keep in mind is we're going to see a person has slowed or shallowed breathing, and this is coupled with a lowered heart rate. These are the two dangerous symptoms that come up. It's also very noticeable when a person is using opioids that the size of their pupil in their eye gets very, very tiny. We call this pinned pupils. Now, when a person is overdosed or taken too much and it's resulted in death, the common medically documented cause is respiratory depression caused by accidental drug overdose. Basically, the body systems have shut down to the point where the person has stopped breathing, and the lack of oxygen to the brain is what causes death. How does Narcan work to reverse an overdose? Narcan, or generically referred to as naloxone, is a drug that can be administered nasally, which is most common, intramuscularly, or intravenously. Narcan is referred to as an opiate antagonist, meaning that it works against the opioid. When Narcan reaches the brain, it works to reverse the binding of the opioid to that mu-opioid receptor, because as long as the opioid is dug into that particular receptor site, the symptoms of respiratory depression as well as other depressant symptoms are going to continue. Not everyone is going to be responsive to the first dose of Narcan. In fact, it may be common for people to require multiple doses of Narcan in order to successfully reverse the overdose. These particulars will be reviewed in a standard Narcan training. How do I get Narcan? Attend a training. Narcan is available in many states without a prescription. Local policies require simply documenting that a person has received training. What's great about this training is that as well as the training itself, the dose of Narcan that comes with it is generally free. And that's thanks in large part due to the public health initiatives that have increased access to this life-saving medication in response to the opioid epidemic. Keep in mind, Narcan is an overdose reversing agent that works on opioids only. If your loved one does not use these particular substances, it may not be a pressing concern. However, having this skill set and being prepared by keeping a Narcan kit with you can be viewed very much the same way as a person who knows and is trained in CPR responding to a stranger who happens to be in need. The point here is that by having this training and having the Narcan kit, you have the ability to save lives. This is valuable both to the people that you love as well as to the general public. How do you support someone who has a substance use disorder? Attend a Narcan training. Again, thank you everybody for checking out Day 9 of National Recovery Month. If you liked what you saw, click that like and subscribe and ring the bell so you can get notifications of further videos that are coming up in this series or in general on this channel. In New Jersey Recovery and Wellness, we appreciate you coming to check us out. Have a good day. Catch you next time.